Good morning. It is a pleasure to have Professor Robert Martindale, who is Professor and Chief of Division of Surgery at Oregon Health Sciences in Portland, Oregon. Professor, welcome to the show.
Thank you.
It's a pleasure to have you here. And why do you think the nutritional intervention in the perioperative period affects the outcome?
Why or how?
Why?
Why?
How? Because that's my following question.
Yeah, sure. I think that we now have almost 100 years of evidence that if we don't do anything, outcomes are very poor.
Okay.
And this is now in major surgery. In minor surgery, a patient who's healthy probably needs nothing, you know. But in certainly people who are having major visceral surgery, esophageal, gastric, pancreatic, major colorectal, those populations clearly can do better with the optimal choice of nutrients, both in the pre-op setting and in the post-op setting.
You already mentioned about the type of surgery who need surgical nutritional intervention, but what kind of patients you think need it more?
Yeah, I think as the population dynamics of the world change and the elderly populations seem to do better with intervention, nutritional intervention, I think that anybody who has preoperative comorbidities or preoperative diabetes, cardiac disease, you know, all these inflammatory diseases, they also can use metabolic preparation. Okay. So almost everyone undergoing major surgery, whether it be orthopedic, thoracic, or general surgery.
Yes. And what do you think is the ideal time to intervene nutritionally?
Ooh, that's a very good question. In the lecture that we'll do today, we talk about the remote preparation for surgery, 30 to 60 days. And there's even beginning to see some data that if you're preparing for a surgery 30 days from now with exercise and high-protein diets, you should do better.
30 to 60
days. Yeah, pre-op. And then there's very good data now, 34 actually, prospective randomized trials showing that 5 days prior to surgery, preparation with a metabolic modulating formulation can lower infection risk and decrease hospital stay in the post-op setting.
Given these facts, what do you think is the current landscape of nutritional intervention or the future of nutritional intervention?
I think we're learning a lot in the last few years. We now have the metabolic tools to show that preoperative manipulation, postoperative feeding decreases mortality, decreases hospital stay, and I think the future is we're going to get better. Okay. We're going to be able to metabolically manipulate the patient to allow better outcomes, shorter length of hospital stay, return to normal activity, decrease complications.
Yes. And the conventional surgeon doesn't actually usually intervene nutritionally. Why do you think is it? It's more common in India.
Yeah, I think it's global. It's not just India where we are now, but I think it's a global problem. I think that first, for many surgeons, there was not specific training in their residency programs, in their surgical training, that nutrition was critical. Yeah. And I must say, the nutrition literature is really vague. Right. And the nutrition literature of 10 and 15 years ago was not scientifically based. Yeah. And the outcomes were poor. Using parenteral nutrition, IV feedings, classically, the outcomes are not good in surgery. So I think now that we've learned why these things are, we now can use what we've learned in the last 5 to 10 years in large trials in multiple different surgical settings to show benefit. So I think the key was there was confusion. Confusion in the literature. How many calories to give? When should we give it? Who should we give it to? There's no good screening tool. We yet to this day have no good screening tool once the patient's had an operation on whether they're nutritionally replete. And we're starting to learn the use of imaging like ultrasound or CT scans, looking at patients' lean body mass. How much muscle have they lost prior to an intervention can now predict their outcome. Yeah. So we're getting there, but we have a lot to learn.
Thank you very much. It was a pleasure having you here.
Thank you.
Thank you very much.
Thank you.
Thank you.